There is a lot of political change in the wind as it pertains to state-funded assistance for child care. State officials recently made plans to cut child care assistance to low-income families and families raising abused or neglected children. That news pushed many to address council on the matter, and now the Urban County Council is taking action.
As you all know, state government has budget problems, and I don't think any of us don't know that, and we all don't know that they have to cut somewhere. But the announcement yesterday basically shuts down assistance to low-income working people to find affordable, decent child care to support them. If you start looking at the numbers a little bit, the lowest income you can have once this is implemented and still be eligible would be $1,628 a month before payroll tax, LFUCG tax, state tax, and everything else that comes out. So the $1,628 person never sees. I think a lot of it depends on a number of different circumstances, but I've looked at a couple of them, and people are ending up with as little as $1,200 a month. Average cost for child care in this county is $500 a month. Take the $500, add $700 fair market rent, and the person has no more money. We find this outrageous. We don't understand how this society can say people who can work should work. Able-bodied people ought to get out there and get a job, but we're going to withdraw the minimal kinds of supports necessary for them to do that. Under the decision that was issued yesterday, effective April 1, no persons can apply for child care assistance from the Commonwealth of Kentucky based on income until June 30, 2014.
I would like to say I'm really shocked by some of the proposed cuts, and the one I want to address, not repeating anything Jack said, is the cutoff of child care to kinship care. We have a large number of children that are removed from homes in this state that are vulnerable, that are very demanding, and rather than go into foster care, they go into the care of family members, sometimes grandparents, sometimes an aunt or an uncle. The means that these people have to take care of these children, some of them may be employed and still required on a low-level job and still required to pick up this because of blood ties. These are not wards of the state, but they would be without these families. I think to cut these families off from child care subsidies is absolutely shocking.
In our meetings, we have a lot of discussion regarding kinship care, and just kind of want to support what Mr. Birch and Mr. Neal said about how this is going to impact. So this is kind of redundant, but I just wanted to just be extra support on that topic, because families who are borderline and just want to work, just want them to have that opportunity to have that dignity to go to work.
Yes, I'm here as a pediatrician, as a parent. Both my children went to childcare in part because my work was our family's health insurance, as it is for many people. So there will also be many people without health insurance if they can't go to work. I just want to make it clear, too, that I understand that the Cabinet is proposing these cuts because they are chronically underfunded, and I don't want our voice to be yet another indictment of the Cabinet. I don't think that's the point. The point is that we as a state have to find the money. And I just wanted to bring up a few more points in addition to supporting the issue of kinship care. The other, and also the issue that child care centers will close, and that will hurt the economy as well as people not being able to go to work. Also, child care assistance makes it possible for poor as well as wealthy kids with special health care needs to attend early start. I didn't know that myself until last year when I tried to send a child that without that support, a poor child with special health care needs will not get into the early start program, and a child who can pay will, and that's not obviously the way we want all of our children to go forward. The other thing is that we have a pretty big issue in our state with child abuse, and we're always telling parents that they should make better choices about who they leave their children with, but they can't make better choices if they don't have any choice. And I think that what we're going to see is if we tell people to go to work and they have nowhere to leave their children except, with anybody they can find, it's not fair to put parents in the position of having to choose poor care, and otherwise we're also going to see more children who are injured because people will have no other choice.
I am actually a participant of child care assistance. I receive child care assistance now, And unfortunately, it is a reality that there are deadbeat parents, mothers and fathers. I mean, you don't want to look at it like that, but it happens. And so child care assistance has given me the opportunity to go out and to work, and gives me the opportunity to leave my child in the care of someone who I do trust, rather than, like the doctor just stated before, having to leave your child with just anyone. So I just wanted to speak on behalf of single parents and those who need the help, who actually don't have the help coming from maybe the other parent, or just need the assistance. So I just believe that it will hurt a lot of single parents. It's not just mothers, but there are single fathers also.
I would like to speak as a licensed clinical social worker. I cut my teeth at Childcare under Kirby Neal. And one of the privileges I had was running a foster care support group. I've also, in my lifetime, been on the other end of the spectrum, where I was a divorced mom with 3 children and no child care money available, and had to scuffle to get where I am now. I would like to speak in support of the child care and also of the kin care. I also ran into something, an extended member of the family recently, in which my husband and I took in, through marriage, some children, and were not able to receive any help. So we did this on our own because we weren't blood relatives, but we didn't want the children in the system. So I ask that you will please look toward this and understand there are people out there in circumstances that are not their own fault that need this help, will come out of the problems that they're in and be tax-paying citizens, and also rear their children so they won't have to go through this cycle too.
I'd like to look at this in a different perspective. The preschool, there was a Perry preschool program that was started in Michigan in the 1960s. There was a group of children who were sent to preschool, and there was a group that was not. The influence that that preschool program had on those children went with them for the rest of their lives. That program, they checked on those children when they became adults, 17, 19, 27, 40 years old. The return on investment for the money that was put into that project was somewhere between 7 and 30%. For every dollar that was invested in the preschool program, the government retained or got back a lot of money on that money. And that reason being that the people who went to preschool, the children who went to preschool as adults, made 30% more income, were half as likely to go to jail, were more likely to have a checking account, were more likely to own a vehicle, more likely to have a job.
I'm a product of this program as well. 20 years ago, I have 2 children. I found myself single and unable to care for myself. So I became a participant in this program, and my 2 children were able to go to childcare while I went and put myself through school, and I obtained a legal degree. And then 6 years after working for an attorney in Georgetown, I decided my daughter had to have surgery, so I decided it was time to stay home with her. And then I started an in-home daycare, and I accepted the child care assistance program there. Was one of the first homes in Scott County to receive 3 stars, which is another government-initiated program. And I now have a center that houses 76 children.
We do a readiness program. We're not a preschool, but we help these low-income children learn from the time they are infants up. We follow a certain curriculum for that, and this helps these children, and I am so thankful to God for this, to where they can go on into preschool and they can say, hey, you're ready to go. And the question I have for you guys is, you guys state, Kentucky states, there's no children left behind.
Without being able to get the early childhood interventions that they need in some of the daycare centers, they will not be ready for kindergarten. And that what we see is when we come into the school and they're not ready for kindergarten, we sometimes don't find out they may have a mental disability or a developmental delay, because at the time when they're in preschool, that's when they're getting a lot of their brain development. And if those children are not allowed to get the learning that they need at those ages, they're really going to be far behind. I work not only with daycares, but I have been on the front line working with grandparents and other families that have been given children, because as we all know, Kentucky has a really bad situation with drugs in a lot of our communities. And a lot of those children are put in safe places with their grandparents and other family members, and those family members may not have the money that they need to provide the child care. And with the kinship care, unfortunately, a lot of people are not even offered that service. But those who are offered the service are those who really need it.
Before I make the motion, I'd like to just say that the expected outcomes of these reductions is inconsistent with providing opportunity for families to work toward financial and economic independence, and contrary to the mission and objective of the Cabinet for Health and Family Services and the values of the people of this great Commonwealth. I move to place on tonight's docket a resolution urging the Commonwealth of Kentucky to clarify and reconsider its decision to cut child care assistance, and requesting that the Kentucky General Assembly take appropriate measures to eliminate or reduce the impact this decision will have on impacted families, and notifying the appropriate officials.
Second. Motion by Councilmember Myers, second by Councilmember Ellinger.
A resolution urging the Commonwealth of Kentucky to clarify and reconsider its decision to cut child care assistance, and requesting that the Kentucky General Assembly take appropriate measures to eliminate or reduce the impact this decision will have on impacted families, and hereby notifying the appropriate officials. Whereas it was announced on January 30th, 2013 that the Commonwealth of Kentucky's Cabinet for Health and Family Services will cut child care assistance to low-income families and will pay no new subsidies to relatives raising abused or neglected children beginning in April 2013. And whereas these cuts will reduce this funding by tens of millions of dollars and impact an estimated existing 8,700 families and 20,000 children, and other future applicants will be denied this funding. And whereas these benefits allow the family members to work and or attain higher education, and these funding reductions could result in primary caregivers leaving the workforce in order to provide child care. And whereas the elimination of these benefits to those raising abused or neglected children will increase the likelihood that some of the children benefiting from this assistance will end up in foster care, which has additional cost ramifications to taxpayers. And whereas there is some likelihood that the ultimate cost to taxpayers and society will be greater than the savings achieved through the proposed cuts due to the potential costs of job loss, increased need for foster care, loss of opportunity to attain higher education, and the increased burden the program participants will place on various public and private community assistance programs. And whereas many of the children that will no longer be able to receive the benefits of this assistance will be denied the opportunity to receive a quality early education, which will have a significant long-term negative economic and societal impact on those children and the citizens of Kentucky, and the advancement of Commonwealth's desired educational outcomes. And whereas the expected outcome of these reductions is consistent with providing opportunities for families to work toward financial and economic independence, and is contrary to the mission and objective of the Cabinet for Health and Family Services and the values of the people of this great Commonwealth. Now therefore be it resolved by the Council of the Lexington Fayette Urban County Government, Section 1, that the preamble to this resolution be and hereby is incorporated by reference as if fully set out herein. Section 2, that the Council of the Lexington Fayette Urban County Government hereby requests that the Commonwealth of Kentucky clarify and reconsider its decision to cut child care assistance, and more specifically address how the needs of those no longer receiving or eligible to receive this assistance will be met, and all of the impact that these reductions are likely to have on the citizens of the Commonwealth of Kentucky. And that the Kentucky General Assembly take appropriate measures to eliminate or reduce the impact this decision will have on impacted families. Section 3, that the clerk of the Lexington Fayette Urban County Council be and hereby is directed to send a copy of this resolution to Governor Steve Beshear, Senate President Robert Stivers, Representative Greg Stumbo, And the following committee chairpersons at their respective legislative offices: Representative Jimmy Lee as chairperson of the House Budget Review Subcommittee on Human Resources, Representative Ruth Ann Palumbo as Fayette County Representative and as chairperson of the House Committee on Economic Development, Representative Tom Birch as chairperson of the House Committee on Health and Welfare, Senator Alice Forgy Kerr as Fayette County's Senator and chairperson of the Senate Committee on Economic Development, Tourism, and Labor, Senator Julie Denton as chairperson of the Senate Committee on Health and Welfare, and the following additional Fayette County legislators at their respective legislative offices: Senator Tom Buford, Senator Julian M. Carroll, Senator Kathy W. Stein, Representative Saini Overly, Representative Jesse Crenshaw, Representative Robert R. Dameron, Representative Robert Benevenuti III, Representative Kelly Flood, Representative Ryan Quarles, Representative Stan Lee, Representative Carl Rollins II, and Representative Susan Westrom. Section 4, that this resolution shall become effective on the date of its passage.